So I am coming to talk to you guys about. First of all, I'm sorry I'm doing a live video. Um, it's just my phone is acting up, so I didn't have any other choice, and I really wanted to post something this morning on my way to work. Um, so this is the reason why. So, anyways, as the title of the video, PCP. I'm not talking about the drug PCP. I am talking about primary care physician. So I just want to give a little bit of insight on why it is so important to have a primary care doctor. Like, if you don't know why, then leave a comment below saying um, what you think it could be the importance of getting a primary care doctor. So primary care doctor is a person that you go to that you see yearly, like it's like your family physician. Um, that's the older terms is your family physician. Um, and your primary care doctor, depending on what is going on with you, as in your health, you could either see them once every 3 months, once every 6 months, or once every nine, or once a year, depending on your specific um, health needs. So, if someone is extremely healthy, they might see their primary care physician maybe twice a year. Especially if you're a woman at a certain age, you might see a primary care doctor a little bit more often than you would as a male, just because there are, gynecology testing that it can be done by your primary care doctor that you don't have to go to a GYN. Um, so it's so important to get one. One is preventative. You want to prevent illnesses from happening. So the best place to go is to go see your primary care doctor so they can do your blood panel to see what's going on in your body and to see what we could do to prevent what's going on with you. So without having testing your blood, having to do a physical exam, then it's kind of really hard to say what's going on with you and specifically because they don't have those testings. No, we just if it's like you have a rash or you clearly broke your arm or leg, something that's physically visible, that's a different thing. But something that's internal that is brewing, like um, maybe some people have precancerous cells that you want to take a sample of and do more testing in the pathology lab. So all of these things are preventative. And in order to get a preventative care, you have to get it done by your primary care doctor, not by the emergency room or an urgent care. A lot of people think they can come to an urgent care and do a physical, which you should not, because they don't know who you are besides what they see in the chart. Especially if you bounce from hospitals to hospitals. If you bounce from hospital to hospital, then it's even harder to get the correct, accurate medical diagnosis for you because sometimes it's harder to share information from one hospital to another. Sometimes it takes days before we can get medical transcripts from one facility to another, especially if you have to move from out of town or out of state, that's fine. You just get all your medical history transferred as you move. So when you get settled into your new place and find a primary care doctor, they would have had everything already set. It could take up to 7 to 10 business days. Sometimes, honestly, depending on the clinic that they are in, it could take a couple of weeks in order to receive. Um, there's a clinic that I know that does not have medical records, so it takes, actually, it's our clinic, it takes us a little bit longer to get things processed because just the fact that we don't have medical records and we have to do it ourselves, and it just takes just a little bit longer. It gets done, but it's just takes a little elbow grease to get it done. Um, so So it's just so important just to go ahead and get it done, get your stuff transferred, see primary care, and do all your preventative clinics. Like some, you have to get your TVs done, you have to do your titers, um, you have to get your physical for job, school, work. I mean, for yourself, just to know exactly what's going on with your body, because it's kind of, it doesn't make sense to me to go throughout life not knowing what's going on with you. You know what's going on with your bank account. You know what's going on with you, as in your social media. You know what's going on with um, the stars. And why don't you want to know what's going on with you personally in your health? Because if you don't find out, who's going to find out? If you don't make the initiative to actually go and get seen and actually do the things you need to do to get your health the right way, then who is going to do it for you? Because no one can go and say, well, my husband is not feeling well, can you just give me medication? That doesn't work. That might have worked a long time ago, but that doesn't work now. So it's very important that you get your medical information together, see your primary care physician, and then go from there. I mean, it doesn't hurt. It doesn't hurt at all. I mean, to find out, it's best to find out than not to find out, because if you find out early enough, either you can cure it, get rid of it, manage it, um, do what you need to do, get your referrals. For example, for myself, I have been dealing with feeling down and feeling just feeling like I'm in a rut. I've been feeling like I've been in a rut for many years. And I always got referrals. Always got referrals to psych. And I never went because I didn't think I need psychiatric help. I'm not saying like I am crazy, I need psychiatric help. I don't want to use the word crazy. I know I did not have a mental illness. That I was certain I did not have mental illness. I know I had a form of anxiety, but I didn't know how bad it was. I mean, it's not like horribly bad. It's moderately there, but with therapy and medication, it actually like is reversing it. So if I didn't get that referral from my primary care doctor, I would have never went. Unless you are like suicidal, then they will see you. But that, it takes weeks weeks to get an appointment with psychiatry. So get it done. That's all I gotta say. Just get it done. Do what you need to do. Get your health together, and that's about it. So on my next video, I am going to try my best to talk about the different qualifications of the primary care physicians. I'm just going to briefly mention them. I probably will talk about this um, sometime this weekend. And there are, of course, medical physicians, MD. There are also osteopathic medicine doctors, which is DO. There are physician assistants, which are PA. And then there are nurse practitioners, which, oh, I'm sorry, it's got really dark. Nurse practitioners, which are, the abbreviation is APRN-CNP. So I will let you guys know exactly what those mean and who is qualified to do what and who's not qualified to do what, and see which one is the better one. I personally have a nurse practitioner. I've had a nurse practitioner as a primary care since 2000, for the last 8 years. So I've loved it. I don't want to switch, but that's my preference. So I'll let you guys know in the next video. But thank you for watching, and make sure you like, subscribe, and share the video. And I'll talk to you guys later. All right, thanks. Bye.